If you are Generation Z entering healthcare right now, you are not stepping into a stable system. You are stepping into a system that has been under pressure for absolute decades, and you can feel it almost immediately. So let's get specific. Since the early 2000s, US healthcare spending has more than doubled. Now it's over 4 trillion annually. Administrative complexity has expanded faster than bedside care. Burnout has reached 40 to 60% across multiple clinician groups. Rural hospital closures continue to reduce access, and mental health and primary care gaps still leave millions underserved. That is not a temporary problem. That is structural. And at the same time, the system has optimized for throughput, standardization, and measurable outputs because all of those are scalable. But human care doesn't operate on perfect predictability. Here's what you're going to experience, Gen Z, when entering the clinical workforce. You will be asked to move faster than what feels safe. You will be measured on things that do not reflect reality. You will see moments where care could have been way better, but the system keeps moving. And it will expect you to adapt quietly. This is where your generation is different. Generation Z does not normalize misalignment. You notice it faster. You question it earlier. And you are more willing to say, this does not make sense. This is not a flaw. Gen Z, this is precision. Your emotional intelligence is not weakness. It allows you to recognize subtle changes in patients, detect early risk, sense when systems are misaligned, and identify burnout before it even becomes collapse. That awareness is exactly what healthcare needs. But awareness alone, it does not protect you. If you want to survive and stay effective, you need structure. You need to stay grounded in reality. Do not override what you are seeing to fit in. You need to build alignment. This is not isolated to one role. Every profession is feeling different pressure points of the same system. And you need to speak with precision. Clear language changes systems, not volume, accuracy. This is where most people always get it wrong. They think the solution is to just push harder inside the same structure. It is not. Because many existing organizations were built within the system that you are now questioning. They adapt to it. They negotiate with it. They survive alongside it. But they were not built specifically to protect your generation inside of it. That is the difference. The Nursing Special Forces Association was built as a national, cross-professional association designed for one purpose: protect the healing workforce before the system consumes it. Not one role, not one specialty, all of it. Nurses, EMTs, respiratory, pharmacy, techs, and the generation stepping in right now. This is not about reaching or reacting after damage is done. It's about building alignment. It's about building protection. It's about building a unified voice across professions before collapse becomes irreversible. If you are entering healthcare and you already feel that something is off, you do not need to ignore it, and you do not need to carry it alone. There is a structure being built for you. You are not here to be absorbed by a broken system. You are here to see it clearly, operate within it intelligently, and help reshape it over time. The future of healthcare will not be decided by policy alone. It will be decided by the people who recognize reality, stay grounded in it, and refuse to disconnect from it. And you do not have to figure that out alone. The NSFA has got your six. Gen Z,